Hey Palvasha, thanks so much for talking with me today about what it's like to be a program analyst at the Ministry of Health.
No problem.
So, how do you describe your job to people who ask what you do?
Yeah, so as a program analyst, my team is responsible for implementing the PSA, which is also known as the Physician Services Agreement. And so that is basically, it relates to the delivery and the implementation of the healthcare within our province. And my team is responsible for implementing that.
Did you always want a job like this?
No, actually. So when I started my program here at Waterloo, I wanted to go into med school. But after doing my very first co-op with the Ministry of Health, that was really eye-opening for me, and that really helped me to see that there's other careers outside of medical school. And so with that was really my stepping stone to to end up in my career here where I am right now.
What does a day at the office look like?
So every day can be very different. So my days can, be doing, doing presentations to writing up funding agreements to writing, policy papers. So every day is very different.
What's an important skill someone in a job like yours needs?
I think an important skill would be your communication skills, whether that be verbal or written skills. You need those verbal skills to be able to present your finding to important key stakeholders, but you also need those written skills to be able to write policy briefs and policy papers.
Best thing about your job?
I think the best thing about my job is that every day is very different. You learn so much every day, and that no 2 days are alike, and so that is what makes it very interesting. And also, the ultimate best part about it is that I know the work I'm doing is really helping to improve the health of the people around me, and just seeing that come through just makes me really happy.
And one of the hardest things about your job?
I think one of the hardest things about my job is, being able to switch your focus very quickly. So sometimes we'll get like urgent requests from higher up, whether that be minister's office, and so that requires you to basically drop everything that you're working on and be able to turn those around. So just really being able to like match my time, and sometimes those come in at a time where you have other competing things happening at the same time. So just being able to have that switch and to be able to turn that around.
One of the most important things you learned in health sciences is?
I think I would say would be systems thinking.
And how does this help you in your job?
So this actually goes really well in my job because when you're writing policy briefs or you're working on making new policies, it's really important to sort of have that systems thinking approach applied to it, whether it be thinking from an equity lens or thinking from an environmental lens or thinking from like an inclusion lens. And so all of these things is what you really learn in the health sciences program here, and so that really helps me in my job every day to be able to sort of take everything and put it into one as I write and work on these policies.
One tip for students who want to get into a career like yours?
I would say definitely go out there and do your research, network with people, and if possible, try to volunteer or work in such an environment to have a feel for what it actually feels like. And I think that's really key and really important for you to have a feel for what you want to do.
And that's it. Thank you so much. Enjoy the rest of your day.
Thank you.